And here you talked of the double whammy, which is you also have to deal with lifestyle diseases, diabetes, cancer, heart. I mean, all of us have some problem or the other that's going across the country. So how do you manage your resources, where on one side you have a clear and present danger, there's virus and we experience the pandemic. Other side, there's another silent epidemic of different kinds. You have an epidemic of diabetes, which everybody now says India is the diabetes capital of the world. Recently, India Today put on the cover TB and its resurgence because of drug-resistant TB. We are getting even more severe cases. So how, as health minister, do you allocate these resources and say, okay, I'm going to handle this, I'm going to handle this. What happens then?
See, Kerala has got a very good system. Like, we have got enough number of hospitals, good number of health workers and professional, well-trained health workers, and they are our real assets. And during these COVID days, see, state was self-sufficient in oxygen production. But what we did during these COVID days, we tried to construct oxygen plants in every hospital. So it's like all the major hospitals are self-sufficient in oxygen production. We have good number of laboratories. We have like hub and spoke model. We have a very good efficient system of lab networking. We have the hubs and the spokes, and also the major labs are connected to the regional labs, the collection points and all. As Dr. Priya has rightly said, WHO has warned about the disease X. It can be zoonotic. So One Health is, we have to really work on One Health. It's a need of the hour. So what Kerala did is that we developed a center for One Health. And health department is leading the center, and we have other departments, all the line departments also, animal husbandry department, agriculture department, etc., etc. So by this August 2023, we will have 250,000 volunteers across the state.
Wow.
So they are trained to detect any new disease or any something which is unusual or something. They are trained. So what they will give the alert message to the system, and also immediately they will act at the local level. So we are really working on One Health. We have developed a One Health center here in Kerala. So I think that's the most important thing that we are doing now.
No, let's give a warm round of applause for that. Really amazing, a lot of foresight, and we hope that kicks in whenever this is there. But I want to come back to you, Veena.
I would like to add, because regarding the Nipah virus, it's like it can be a war weapon.
Yeah.
Bioterrorism. So only in India, the Indian Council of Medical Research and the labs under the Indian Council of Medical Research can handle. They have to say that, yes, this is Nipah, this is positive. No one has, anyone else, they don't have the right to test the sample. They can test, of course, but it's very dangerous. So we face restrictions.
I mean, it's like the Wuhan laboratory leak
I think that's a very important point that ma'am has touched upon, that very often when you have to handle the live virus, there are not many labs that have that biocontainment, which, you know, when you visited NIV, we have the highest order of biocontainment, where both the worker is safe and you're not releasing anything very dangerous to the environment.